Uh, Did you know that scoliosis is more common in ballet dancers when compared to non-ballet dancers? Hey, Dr. Chris Googles here with Scoliosis Denver, and for the next couple of months, we are really focusing on educating people about the prevalence of scoliosis, specifically in adolescents that are involved in activities such as ballet, rhythmic gymnastics, and things like cheer. So I just wanted to go over one study today that talked about the prevalence in dancers compared to non-dancers, and which really demonstrates how the incidence in scoliosis in these groups is much higher compared to people that are not involved in these groups. So this is the study that we're going to talk about. And in this study, the authors looked at 30 different ballet dancers and they assessed them for scoliosis, looking at a couple of different things. The primary method they used for evaluating scoliosis was the Adams forward bending test, which is the test that we all used to get at schools, where the school nurse would have you bend over, and then they would actually look for any humping or rotation in your spine. And the authors use a tool called the scoliometer that actually is used to detect rotation in the spine. And in the thoracic spine, if you have more than 5 degrees of rotation, that indicates scoliosis. And if you have, more than 7 degrees in the thoracic spine, and if you have more than 5 degrees of rotation in your lower back or lumbar spine, that indicates scoliosis. So the authors did this, and they found that 30% of the ballet dancers tested positive for scoliosis, and this was compared to only 3% of non-dancers. So that they found that there is a 12.4 increased odds of developing scoliosis if you participate in ballet compared to if you don't participate in ballet. Now, why exactly this is, they didn't say 100%, but one of the other things they found is that ballet dancers were also much more likely to have global hypermobility. In fact, 70% of the dancers tested positive for global hypermobility using what's known as the Beighton mobility test or scoring method, compared to only 3% of non-dancers. And so their conclusion was that adolescent dancers, similar to adult dancers, are at a significantly higher risk of developing scoliosis than non-dancers of the same age. So there needs to be diligent screenings and improved education for teachers and parents that have children involved in dance. Now, the Scoliosis Research Society recommends that girls should be screened for scoliosis at the ages of 10 and 12 years old, and boys should be screened for scoliosis at the ages or between the age of 13 and 14. The reason for this is idiopathic scoliosis tends to present with the onset of growth spurts, and in girls, growth spurts tends to happen between 10 and 12, and boys between 13 and 14. The reason this happens around growth spurts is during the first 2 years of puberty, you grow extremely rapid. This is called your peak height velocity. And it's during this phase where the spine really takes off. What's also interesting, that before adolescence, or before growth spurts, the majority of your growth actually comes from your limbs. And with the onset of puberty, that changes, and the majority of your growth actually comes from the spine. So with the onset of growth spurts in puberty, you have two things that are happening. One, you're growing very rapidly, the fastest you have grown since before you were 5 years old, and the majority of that growth is actually coming from your spine. Now, scoliosis is a three-dimensional spine deformity. And because you're growing very rapidly during this phase, the curves can progress really rapidly, which is why we want to catch these earlier, because when we get earlier treatments earlier on, we have more effective treatments. Now, why do dancers tend to have an increased incidence of scoliosis compared to non-dancers? Well, one, these girls are typically thinner and leaner. There's some studies that show that they are more likely to have less muscle strength and stability. Some show that they have decreased proprioception, which sounds odd to me because I would think they would actually have a higher incidence or a higher rating for proprioception. One study I looked at showed that they think that these populations select ballet and gymnastics and stuff because they have increased hypermobility, so they're likely better at them just because of that. But we don't know 100%. But we know increased hypermobility, I mean, it could increase the risk of scoliosis. We have nothing that I'm aware of that actually states that 100%. But we know that we find these both in dancers. Um, so if you have a child, first of all, if you have a child, a girl between 10 and 12, they should be evaluated for scoliosis by a trained specialist. Or if you have a boy between 13 and 14. Or if you have children beyond those ages that have never been checked, you should still get them checked. But 100%, if you have a child involved in dance or ballet or gymnastics, you should absolutely be checking for these. On our YouTube page, I have some videos that show you 7 signs of scoliosis to look for. And here at ScolioCare Denver, we offer free screenings for scoliosis. And if we think someone has scoliosis, we can take an x-ray to rule scoliosis in or out. So I hope you found this information helpful. If your child is involved in ballet, gymnastics, or cheer, be sure that you get them checked for scoliosis.